Ya mali mlitoka tu kwa nasi.
Sawa, asante.
Sawa, asante sana.
Okay, thank you all. I hope you enjoyed.
4% of Kenyan's population living with diabetes, the Cabinet Secretary for Health, Dr. Deborah Baraza, has said. According to Dr. Baraza, of the population live with diabetes, 43% of them are undiagnosed, hence the need for Kenyans to regularly check their blood sugar levels. In a speech read on her behalf, the head of non-communicable disease divisions in the Ministry of Health, Dr. Gladwell Gathecha, during the commemoration of this year's World Diabetes Day in Siaya, the cabinet secretary said that children, adolescents, and the elderly living with the condition bear the brunt of the condition, hence the need to give more focus on the population.
Distinguished guests, ladies and gentlemen, I am truly honored to be with you today as we commemorate together World Diabetes Day here in Siaya. This is a great moment for us to reflect and assess the progress we have made and steps to undertake in our fight against diabetes. In Kenya, an estimated 4% of the population are living with diabetes. Of concern is that 43% of Kenyans with diabetes are undiagnosed. Kwa hivyo kuna watu wengi sana wanatembea bila kujua wako na ugonjwa wa kisukari. So saa zingine symptoms hazikujangi hivyo, na kile mtu anafaa kufanya hivi ili agunduliwe ako na kisukari ni kupimwa. Kwa hivyo sasa hii kuna watu 43% hawajapimwa, wako na kisukari na hawajui wako na hiyo ugonjwa. This year's theme, Diabetes and Well-being, reminds us of the broader implications of diabetes. It is a call for action to consider the physical, emotional, and social aspects of living with and managing diabetes. This is a campaign for expanded approach to diabetes care. Our focus should not only be on the medical management aspect of the disease, but also fostering the emotional, social, and mental well-being of those affected. As a country, we need to emphasize on undertaking a holistic approach to diabetes well-being by promoting lifestyle changes. Diabetes, specifically type 2, is largely preventable and manageable through optimal lifestyle adjustments. Eating a healthy diet, physical activity, stopping alcohol and tobacco use are a key to preventing diabetes and maintaining well-being. We recognize the role the healthcare workers and the community health promoters, peer educators, and community leaders have been playing in this endeavor. Secondly, providing mental health support. Living with chronic condition, and in this case diabetes, takes an emotional toll among individuals, resulting in stress and burnout. Therefore, mental health support is an integral part of diabetes care within our setup. We have made significant steps to enhance mental health support by integrating patient support in diabetes training package and counseling services in most of our facilities. Additionally, we are currently training peer educators and establishing patient support groups across the country to enhance mental health support. The third thing is providing accessible health care. One of the significant barriers to diabetes care is access to proper health care that is affordable and reliable, regardless of where one is living or their economic status. Our health systems must work to make diabetes management affordable and accessible across the country. Ladies and gentlemen, diabetes is a manageable condition, and with the right treatment, persons living with diabetes can live a long and productive lives free of complications such as blindness, kidney disease, heart diseases, and even amputations. Children, adolescents, and elderly living with diabetes bear the greatest brunt of the condition, and thus there is need to give more focus on this population. The Ministry of Health, in collaboration with the county governments and other stakeholders, has made significant strides to improve access to diabetes screening, diagnosis, and care. We developed and rolled out clinical guidelines and competency-based training curriculum on diabetes for healthcare providers. We have also equipped our community health promoters with glucometers and blood pressure machines. These initiatives has enabled the Nyambreras to conduct diabetes screening at the community level and refer individuals with raised blood sugars to the health facility. for confirmatory tests and management. As we all know, early detection is key to effective diabetes management. The Nyamreras are equally providing regular health education at the community level on preventive care. In regards to health
and all distinguished guests and partners, today we join the world in commemorating World Diabetes Day to raise awareness of diabetes and its impact while strengthening our collective efforts in prevention, diagnosis, and treatment. Diabetes cases in Siaya County have risen in recent years from 6,784 in 2021 to a peak of 12,170 in 2023 and steadily continuing to rise in 2024. This trend, above the national prevalence of 4%, highlights an urgent need for stronger diabetes prevention and screening, as well as care initiatives to address the ongoing burden. It is an honor for Siaya County to host this year's national commemoration, and I warmly welcome all our guests. We are grateful for this opportunity to lead in advancing diabetes care. The theme, that is diabetes and well-being, aligns with our commitment to accessible, affordable, and quality care for diabetes patients in Siaya. Health is a core priority in Siaya, and we have made significant strides in equipping our facilities, hiring skilled manpower, and supporting over 2,100 community health promoters. Our partnership with the national government has enabled us to equip 1,974 community health promoters with screening kits to detect non-communicable diseases at the household level, though some still need additional resources. We refer those screened positive cases to our well-equipped health facilities, including 10 Tier 4 hospitals, where specialized diabetic clinics provide comprehensive care to over 1,000 patients monthly. Through ongoing capacity building and community awareness, we are working to ensure early detection, prevention, and better health outcomes for all. We are grateful for the support of our partners, Kenya Diabetes Management Information Center, World Diabetes Foundation, Medtronic Labs, and others who stand with us in improving our lives. And lastly, we appreciate the Minister of Health and the national government for their crucial support in guiding and enabling our efforts. Thank you. That is the message from the governor for this special day, and I think it is clear and to the point. As I conclude, therefore, I just want to reiterate and assure our guests that the county government of Siaya is indeed committed to promoting healthcare services, as has been alluded in the governor's speech and also by health department. We also want to encourage members of the public, those who are here today, to visit the tents across there, to be able to get screened because the services are being provided there free of charge, so that you can know your status as we have been advised. Indeed, the most important lesson we have drawn today from the previous speakers is that we should do everything possible to prevent getting diabetes by doing the things we have been told to do, looking at our lifestyle and diet. But the event that you get caught up, then you have to embark on the management process, and you can still live much, much longer. I also want to appreciate our healthcare workers on behalf of the governor again for the good job you are doing in this county, and we appreciate all of you. We also want to commit to strengthen our partnership with the Ministry of Health, because when we work together, we achieve more. The partnership is existing, and we want it to be stronger than it is.